Hi, Debanjali. Thank you for joining us.
Hello, ma'am. Thank you so much for inviting me. It's such a good opportunity. Thank you.
So the topic for today is EKC. So which means we're going to discuss in detail about the epidemic and outbreak prevention of EKC. So I would like to welcome my my co-participants and the in charges, Ms. Meenakshi and Ms. Zulaiha ma'am. Hi ma'am.
Hi, Gomati.
Yes ma'am. So what is about today's topic ma'am? So we'd like to hear from you ma'am.
So this is something which we often see every year. So when we see about this EKC or something which is related to the epidemic, we just see in the clinics only majorly about redness, conjunctivitis, everything. So when we say an epidemic outbreak, we all know about what has happened in 2020. So there is a pandemic outbreak in the entire world had. So now when you say this epidemic, it is going to be in a particular area alone. So recently, last 10 days back, we saw a few hundreds of cases in Delhi. So we thought, okay, fine, this is something which is going to happen in the next 2-3 weeks. So it can spread all over the world. So we thought, okay, fine, we will have this as an awareness in this session. So we have a moderator here. So Ms. Debanjali was interested in speaking about this as well. So that is why we are today gathered here to speak about that. So we all know about conjunctivitis. There are different types of conjunctivitis, starting from mild redness, watering to there are discharge, types of discharge. So each and every signs and symptom will speak about each and every type. Okay. So the normal people who travel daily also will experience mild redness and watering. So that should not be misdiagnosed by themselves as just a redness. If they live like that, it can spread into a it can be an epidemic outbreak in their particular area. So we are considering this as a time for giving them an awareness. So everywhere we have to, we are in a place to give awareness to the public. So today this is going to be the topic. So I welcome Debanjali. So she, when I contacted her, she immediately said, "Okay, I'm fine. I'm good. I'll take the session." And she also wanted to speak about this. So hi, Debanjali.
Hello, thank you.
Thank you ma'am. Now I call Ms. Afrin to introduce the moderator.
Good evening, ma'am.
Yes, Afrin, continue.
Hi. Good evening, Afrin. You are audible. Please, yes.
Good evening to one and all present here. I'm Afrin Farhana, doing my second year in Dr. Agarwal's Institute of Optometry, Chennai. It's my pleasure to welcome you all to the 14th episode of Optometry series. The topic of today Optometry series is epidemic keratoconjunctivitis. It's indeed a great honor and pleasure to welcome the moderator for today's session, Ms. Debanjali ma'am. She has done her diploma from the State Medical Faculty of West Bengal, followed by BSc Optometry. Then she started her career from Lenskart itself with 5+ years of retail experience. In between, she completed her MBA of Human Resources from Chandigarh University. Now, currently, she is handling professional services in Central Department at Lenskart. Thank you for accepting our invite, ma'am. Now it's time to welcome our speaker, Ms. Pooja N from 3rd year, a student and multimedia member of Dr. Agarwal's Institute of Optometry. Ms. Pooja, you can start your presentation now.
Thank you, Afrin, and good evening to everyone. I'm Pooja from 3rd year of Dr. Agarwal's Institute of Optometry. I'll just start my presentation now. Okay. Is the screen visible, ma'am?
Yes, Pooja, continue.
Okay. Okay, today's topic is epidemic keratoconjunctivitis, outbreak and its prevention. So what is epidemic keratoconjunctivitis? It is a type of acute follicular conjunctivitis, which is highly contagious infection of the ocular surface, and it's also It also has a characteristics of acute follicular conjunctivitis. It is a viral conjunctivitis caused by a group of adenoviruses, and it has a tendency to occur in epidemics, and it had been reported worldwide. Major transmission of this condition is due to direct contact with the eye secretions, air droplets, swimming pools, and any contaminated items. So the prevalence of this condition in the South region is approximately found to be 2%. And when comparing with the genders, male are more prone than the females, with the percentage of 0.92% of the males and 0.66% of the females. Whereas in the ratio of urban, rural, metropolitan distribution, the urban distributions are more affected by this EKC with a percentage of 0.82%, while the rural is of 0.80% and the metropolitan distribution is of 0.70%. We're comparing to the adults, children are more affected with the percentage of 0.89% and adults of 0.78%. The cause, as said before, this condition is caused by a group of adenoviruses, and there are actually many types of serotypes of this adenovirus group, and the main types are 8, 19, and 37, which causes this condition. Because of the low natural immunity against this adenovirus pathogen, generally most of the population are susceptible to this epidemic, and the major transmission is due to the direct contact with the contaminated items or any instruments or the affected people. So risk factors, who are all are major risk factors for this condition are adults with between the age of 20 to 40. And as it is a highly contagious condition, most of the person who are in contact with the affected person or any items that are contaminated are more prone. This condition actually mainly spreads among in the clumsy places and where it is so crowded. So this is found to be mostly spreaded in the offices, classrooms, daycare centers, crowded spaces, and places which are more with the population. If there is any underlying conditions present like asthma and eczema, this it is found to be a risk factor for this condition. And clinical features, the signs of this condition mainly are conjunctival hyperemia, as seen in this picture. The bulbar conjunctiva is affected by the condition, while the palpebral conjunctiva is also affected. Follicular reaction, as found in these two pictures, the lower lid, here the lower lid is represented with the follicular reactions, while epithelial keratitis, subepithelial infiltrates, and conjunctival edema, that is chemosis, pseudomembrane formation of the conjunctiva, discharge, and periocular lymphadenopathy are also present. Well, in this picture, the first and the last picture is of the subepithelial infiltrates. The third picture shows this pseudomembrane of the conjunctiva in the upper eyelid. This picture shows the ciliary flesh in the cornea, around the cornea, sorry. Next, the symptoms. Patients usually undergo photophobia due to the conditions, and as it is a viral conjunctivitis, patient experience epiphora. They also experience ocular itchiness, irritation, along with foreign body sensation. They also experience blurred vision due to the reduction in the visual acuity. They are in the systemic relations. They also experience fever, headache, and fatigue. Investigation. How can this condition be investigated? With our common step, history can be taken. Along with slit lamp examination, if there is no slit lamp that could be used, we can use the pentoj examination. For finding the pathogen, we can use cell culture to culture the sample from the conjunctiva and see which organism is being present. And with immune assays, we can find out which serotype of adenovirus is affecting. With polymerase chain reaction, we can find which group of virus that is affecting. With antigen detection, we can find out which antigen and antibody that is being responsible for this cause. With nucleic acid detection, we can find whether it is an RNA or DNA viruses that has been affected. And with electron microscopy, we can study more about the structure of the microorganism. So differential diagnosis, as conjunctivitis is a vast condition with a lot of types, this can be misdiagnosed by other conditions. So the differential diagnosis that is suited for this condition is bacterial, allergic, toxic, and other viral conjunctivitis. The symptoms which are compared from EKC to bacterial conjunctivitis are bacterial conjunctivitis are less severe with the foreign body sensation. And in the physical findings, bacterial conjunctivitis are usually unilateral with mucopurulent secretion with less chemosis. The helpful aid to differentiate this bacterial conjunctivitis from EKC is conjunctival swab. We can differentiate it via cell culture or things in microbiological context. So allergic conjunctivitis is differentiated from EKC with itching, tearing, foreign body sensation. With its physical findings that shows papillary conjunctival edema ranging to so-called cobblestones. This can be differentiated by using history because the allergy can be mentioned in the history itself. Toxic conjunctivitis is shows irritation, burning, foreign body sensation from EKC, while the physical finding shows diffuse conjunctival hyperemia or PELA and follicular changes. We can differentiate it with the history itself. Another type of viral conjunctivitis shows similar symptoms like as EKC, but in physical findings, it differs from EKC by conjunctival hyperemia, follicular swelling, and usually they are unilateral. We can differentiate it by using lid examination from molluscum contagiosum lesions and history with the immune status. Treatment. Okay. EKC is mostly self-limiting conditions. So minor symptomatic treatments given to the individuals can provide measure of the comfort, and antiviral drugs are mostly not prescribed. For reducing discomfort and irritation, cold compresses are used. The discharges are usually carefully cleaned with soft and wet cotton wools. For dry eye symptoms, we can use lubricants to treat it. And cycloplegics are used if there is a lot of photophobia. Topical corticosteroids are used if iris and the cornea are involved. And topical antibiotics ointments are used if recommended to prevent bacterial infections. Contact lenses are avoided during this period because of the ocular surface infection, and spectacles are prescribed to wear instead. If the symptoms affect the whole body, then systemic treatment is needed. Prevention. Condition spreads when there is a crowded area. So avoid crowding and isolation when the spread can be practiced. To prevent spread of the condition, we can maintain hygiene by washing hands regularly, by not sharing any pillows, cups, or any items, and by limiting physical contact. To prevent aggravation of the condition, by staying out of the sun, keeping away from the dust and smoke. Also avoid touching or rubbing the eyes. The condition is seasonal and individuals may chronically contact EKC. Diagnosis. Most of the cases of epidemic keratoconjunctivitis are self-limiting and have excellent outcome with supportive management of the condition. If there are other underlying conditions that aggravate the infection, then certain complications may develop that would require an extended treatment course. EKC is a chronic infection and can reoccur if conditions are conducive to its recurrence. So these are my references. So let's now see a case relating to EKC. So we had a 38 38-year-old female patient, and she had a complaint of pain, redness, watering, and irritations in face, where her symptoms was severe in the left eye than the right eye. She also had blurring of vision for 3 days, along with a report of mild fever. So she had no any previous ocular history, and she had no surgery, trauma, or contact lens usage in the eyes. Her general health was good, and there was no contributory in the family history, and there was no any recent investigation. She was found to be over-the-counter eye drops, and then no aware. For the ocular examination, she didn't have any previous glass spectacle history. Activity that was deferred because of pain. In the slit examination, it was found that the upper lid has crusts and follicles been seen. There was conjunctival congestion of grade 3. Around the cornea, there was ciliary flush along with stromal infiltrates. The pupil were reactive to light. The lower lid of the left eye alone had pseudomembrane, while both the lower eyelids had discharge been seen. So in this first picture, the ciliary flush can be seen around the cornea. And the second picture denotes the follicles in the lower eyelid. And third picture shows the crust discharge in the upper eyelid, while the fourth picture epidemic keratoconjunctivitis. So the advices and precautions that were given was cold compressed for the irritation and foreign body sensation, and for artificial tears were given for dry eyes. They were advised to prevent any contagious spread. Antibiotics were given to prevent bacterial infections. Pseudomembrane of the lower eyelid was advised to be peeled off, and prednisolone was prescribed. Then the patient was asked for recurrent observations. Thank you.
Thank you, Pooja. Gomati?
Thank you so much, Pooja. Now, request of moderator, Ms. Debanjali ma'am, to share her views. Hi, ma'am.
Yeah, hi. So it has been beautifully presented.
So, what is your
by Pooja.
opinion about the PPT, ma'am?
Yeah, I'm just telling that. So she has covered maximum things in her PPT, and that last chart was actually important. No, from there we can differentiate in between bacterial, viral, and such allergic conjunctivitis. So I have just made one small PPT to make it just simple. So I would like to share my screen. So after that we can take some questions, right? So maximum things she has covered. So I'm just sharing my screen. May I?
Yes, ma'am, sure.
Okay. Is it visible?
Yes, ma'am.
Yeah. So yes, so regarding epidemic outbreak and prevention. So we have talked about conjunctivitis, and it's about EKC, right? Epidemic keratoconjunctivitis. But I would say before talking about epidemic keratoconjunctivitis, we should talk about total conjunctivitis. And I'm just taking everything in one page, okay? So if we see the types of conjunctivitis, at first we can differentiate initially in two parts, right? First is infective and another one is allergic. So in between infective, we can see acute, which is acute mucopurulent serous membranous. And if we talk about EKC, that is basically coming to the part of follicular conjunctivitis, right? That is subacute or chronic. And we can see also allergic conjunctivitis, that is basically VKC, vernal keratoconjunctivitis. We can see for a child patient from 5 to 12 years of patient. So we can see different type of conjunctivitis. Now, if we talk about EKC, before that, we have to diagnose properly, right? That how it is, or how can we supposed to understand this is conjunctivitis. So before that, at first, we have to take the history properly, which Pooja has mentioned in her slides already. That is, at first we have to check if they are having anyone in his family who is having also conjunctivitis or not. Then we have to check if it is in bilateral or not. And if we come to the clinical examination part, so there we can see that first thing is we have to check the discharge, right? Watery discharge. So if that is viral, so we can see there should be watery discharge. But maximum time in bacterial cases, we can see there should be yellowish type of discharge we can see. Next thing we can see, that is mucopurulent discharge, or lids are sticking. These things we can see. Or next thing I can say reaction, right? So reaction we can able to understand by slit lamp. So slit lamp examination is also taking a good part here. So first thing is, important thing is, I would like to say regarding congestion, right? That is ciliary congestion, and another one is conjunctival congestion. So for conjunctival congestion, we can see the redness should be, means deeper redness will be there. And that is, I can show you, yeah. So if we talk about this conjunctival congestion, so the redness should be less or least in limbus area. And ciliary, circumciliary condition we can see in keratoconjunctivitis, as well as angle closure glaucoma also we can see these things. Next thing is, we can observe if there is any papillary or if there is any follicles, that also we have to see. So papillary is basically the inflammatory cells, so that also we can observe by slit lamp. As well as follicles, we can see if there is any follicles. So this should be, right, small tiny blood vessels, right? So these are like a little swelling in the eyes. So as well as we can see follicles for EKC as well, right? For EKC, as you have mentioned already. Next thing is, we can see chemosis. If there is any edema or chemosis, that is one of the clinical part. Then sometimes I have seen that there is subconjunctival hemorrhage also present. So these are the things you can see in conjunctivitis and different type of conjunctivitis. Okay. So next, if we talk about epidemic keratoconjunctivitis now, so it is highly contagious, and it is due to adenovirus, that is 8, 19, and 37, and often occurs in epidemic form. So what are the basic signs or symptoms? We can see that is redness should be there, irritation should be there, and foreign body sensation you can see, and blood vision, or visions is not clear, like 612 or 624 also sometimes we can see. And the main thing is, after 7 to 10 days of keratoconjunctivitis or EKC, sometimes we can see there should be some SPK, right? So, superficial punctate keratitis we can see sometimes, or some means photophobia should be there. These are the parts. And sometimes maybe it's not means for all the cases, but maximum times we can see there should be some opacity after 1 month, and it may stays for 1 month as well, right? So these are the things we can observe in epidemic keratoconjunctivitis. So basically we have to segregate after seeing the signs and symptoms, right? Means what is the thing is happening, and we have to ask to the patient. So history taking is playing a main role over here, I would say. So we can see from discharge, means watery discharge as well, or if it is yellowish discharge, I have already mentioned. And then, yeah, so here I have just attached some photos, like SPK, we can see like that, and opacity should be like that. So then if we are coming to the acute mucopurulent conjunctivitis, these are also, it's not epidemic, but we can see, means maximum time we can see. So in these cases, it can happen for any years or any ages of patient due to poor personal hygiene. And then symptoms, how can you supposed to understand this is mucopurulent conjunctivitis? There should be redness, discharge should be there. Patient may complain that I'm having foreign body sensation. So stickiness of eyes, this, and we can see that lid edema. I have already mentioned that conjunctival congestion, right? So these things you can see over there. Now, if we are coming to the simple chronic conjunctivitis as well, so we can see these things as well. Burning sensation as well as redness should be there. Then we need to see also fornix area. So these parts you can see by slit lamp as well, right? And by torchlight. And if we talk about VKC, so VKC is basically, we can see for, means vernal conjunctivitis is for children 5 to 12 years or 15 years in between. So it is maximum time, we can see that it's in summer season, it is increasing, right? External allergens, dust, pollens for this reason. So patient should complain that I'm having severe itching. Sometime ropey discharge should be there. Inflammation also you can see, and they should have foreign body sensation. So we would suggest a patient to wear black sunglasses or black eyeglasses like that, and to wash their eyes with cold water. These are the things. And signs, if we see in VKC, that time we can see this is 3 types of basically, that is palpebral, bulbar, and mixed types. So we can see papillaries over there in the palpebral area and bulbar area. We can see like white type of some lesions should be there. Okay, so now if we are talking about treatments that you have already mentioned, that we should have to take the proper guidance. So maximum time I can see that some of my friend also asking that I'm having redness in my eyes. So what should I do? So they are going to the pharmacy and they are taking some random steroid or whatever it is. They are not taking even proper guidance from an ophthalmologist or optometrist. So this should not be done. So you have to go to an optometrist or an ophthalmologist because your vision may decrease, right? And sometimes you are taking steroid drops and you even don't know what is happening. So patient should take the proper guidance. And do's and don'ts, I should say that you have to clean your hands. And these are the basic things you have to maintain to keep your hygiene, right? And rubbing eyes and contact lens wearing, this you won't do. And that's it. Means conjunctivitis, it's not a like, it's not manageable or it's not like that, but you have to take the means initiative from the first day. Means if we are seeing redness in the eyes and randomly we are giving something, we don't know what is this, so we have to maintain these things. So that's all. That's it. Thank you.
Thank you so much, ma'am. Thank you for your effort to make it understand better. There are a few questions in the YouTube and in the Zoom chat, ma'am. So I request Meenakshi to conduct the Q&A session.
Okay.
Hello, ma'am.
Yeah, hi, Meenakshi.
We will start with the Zoom questions, ma'am.
Yes, yes, please.
The first question is, how does it differ from normal conjunctivitis?
Yes, so I have already mentioned in my
Yes,
PPT, right? How can you supposed to check? Means when you are differentiate conjunctivitis, now before that you have to know if it is infective or if it is allergic. So if it is infective, in between that only EKC is coming, right? You can see the follicles over there. You have to check by slit lamps as well as follicles. We can see in torchlight, by torchlight as well, right? So by this only we can check that.
Okay. Second question is, what is the first symptom to understand it is of EKC?
First symptom is there should be redness, like same like infective cases, what we can see, right? Redness, blur vision. Sometimes patient may complain that I'm having burning sensation. Sometimes due to inflammation, burning sensation should be there. And if patient is coming after 6-7 days, that time SPK may arise, right? So you have to check if there is any SPK. So for that, inflammation should be there, and patient will have a pricking sensation or foreign body sensation. So these are the common.
Thank you, ma'am. Next question is, what signs will help us to differentiate various conjunctivitis?
Sorry, what?
What signs will help us to differentiate various conjunctivitis?
Okay. So various conjunctivitis. So first I would say there is bacterial, viral and allergic, right? So this is the basic thing. So what I would say, if you are seeing there is watery discharge, you can think that is viral, and you have to ask the patient if they are having pain in their eyes or from how many days, or you can see redness, right? And for bacterial, you can see there should be yellowish discharge. I have already mentioned in my slide. And for allergic, there should be inflammation. They will have itching, redness as well. So these are the things you can differentiate.
Thank you, ma'am. Next question, will it cause uveitis?
Uveitis is basically inflammation of uvea, right? So it may cause by different reason, like for trauma as well, it can happen. For inflammation as well, it can happen. So we should have to check properly. So what it is happening, maximum time, what is our problem or what is patient problem? They don't go to the optometrist and to an ophthalmologist. So they are just going to the pharmacy and they are just randomly taking some medicines and applying. So after that, anything can happen. Glaucoma, you don't know what may happen, right? You are taking steroids from long time. So uveitis is also that. So it's inflammation of uvea. So due to these reasons, it can happen.
The last question, ma'am, what effects will EKC cause after the treatment?
What?
Effects.
What
will EKC, will EKC leave behind after the treatment?
Yes, that I have mentioned already. That is opacity. Opacity is one of the things that we can see after 1 month. Or maybe sometimes opacity is curable, but if you are seeing that opacity is disturbing in our vision, right? So that time you should consult to an optometrist or ophthalmologist. Initially, we just do give lubricating or something. But if that is causing vision effect or something, so that time you should take the guidance from an specialist.
Thank you, ma'am. Julia, ma'am, would you like to add any points, ma'am?
Thank you, Debanjali. It's a very extensive class about conjunctivitis. So I think after a long time, I'm sitting and hearing an ocular disease class because I used to take ocular disease. Okay, so to the previous question, I just wanted to add a point. So there is a question about whether the patient can get uveitis after this EKC. Okay, so there is one type of viral infection which is which can cause iridocyclitis as well. So there is something called as herpes virus. So when we speak about this EKC is also a viral infection, but it is caused by adenovirus. So I don't think this may directly cause iridocyclitis, but it can become a complication when there are steroids given, because steroids can have complications in different ways. So we are suppressing the immune system. So there are possibilities of getting anything after a steroid injection or the drugs which we are giving. So herpes can cause a iridocyclitis in the late stage. So this is what I wanted to say. And differentiating the types of conjunctivitis, I think the discharge will play the major role. So when we say grossly, there are different types of conjunctivitis, but grossly we say infective and allergic. So allergic will be along with allergic rashes around the eye sometimes, or when you ask the patient may give a positive history of any allergen, contact with any allergen. So in this way, we can differentiate. If there is a watery discharge, when you say watery discharge, viral also can get watery discharge. Allergic also can get watery discharge. So if there is a yes for an allergen contact, then it is allergic. So in this way also we can differentiate. And mucoidal discharge is seen only in, sorry, 1 minute. So this,
Just a
sorry,
minute, ma'am.
so about this bacterial conjunctivitis alone has mucoidal discharge because of the replication of the goblet cells. So that is easy to identify. This epidemic keratoconjunctivitis is very crucial because it is highly contagious. So if one person in a family gets, many people can get in their family and it can spread out. So adenovirus is the one which is really dangerous in spreading very easily. So I think we had a very detailed explanation about the conjunctivitis and hope this helps the optometrists as well as the public people. So we have to be safe and we should keep our environment also safe. We have to keep our colleagues, family members, everybody in safe status. Any other questions, Omati?
No, ma'am. No more questions, ma'am. We have answered all the questions. Thank you so much, Zulaiha, ma'am. Thank you, Meenakshi, for conducting the Q&A session. I would like to thank Debanjali, ma'am, for accepting the invite and for the presentation. Thank you so much, ma'am.
Thank you. I would like to come once again for another session. And it was
Sure,
a
we will
introduction
invite
session.
you. We'll
Thank
invite you
you.
for future sessions also. Thank you,
Thank
Ms. Debanjali. Thank you.
It's a good experience. Thank you. Bye.
Thank you.
Bye.
Bye, ma'am. So, dear audiences, the news for this particular week is I'm very happy to welcome the new batch, the 18th batch to the Agarwalians family. Welcome C18 for the Agarwalians family. We wish you all the very best on behalf of the management. To know more about the updates about the college, please do follow the Instagram page, Facebook page, and the LinkedIn page. The link of all this will be provided in the description box. We will meet you all in the next episode. If you like this video, please give a thumbs up and share with your friends. Tata, see you.